All right. The wrath of Hurricane Ida came possibly at the worst time for hospitals that were dealing with this fourth surge of COVID cases. I mean, hospitals have been stressed, doctors have been stressed for a long time. Dr. Patricia Adhikari is with Tulane Medical Center and joins us live over Zoom. And right now, what are the conditions like over where you guys are?
Actually, they've gotten quite a bit better. We've been fortunate with our backup generator power, et cetera, initially, and then now we're back on city power. So things are actually looking a good bit better. We're also down right near the CBD, so power is starting to get restored everywhere.
How full are you right now with COVID patients? And because we've talked to other hospitals, and I mean, there's been a lot of hospitals with tons of COVID patients, and it's kind of gone on the back burner while we deal with all this this Ida stuff.
Yeah, you're right. And that was the difference this storm versus any of the others, actually, is we started pretty darn full. And so that's been the biggest challenge, is trying to be able to shift people around, figure out how to discharge them. Because once a storm hit, being able to safely discharge patients is part of our job. And so that has been quite a challenge. The ER has been boarding a lot of patients. We were able to make some room yesterday, but we're full again.
And what has that done to people who were under cancer treatment or dialysis or whatever? I mean, it became a real problem, even before Ida, because there were so many COVID patients.
Yeah, you're 100% right about that. It's been quite a challenge with COVID, and I guess, I hate to say it, but maybe having the COVID surge and being pretty full started us getting ready to figure out how to do those things before. And it just kind of got stepped up. We were lucky enough, unlike a lot of the hospitals in Jefferson Parish, we kept water pressure. So dialysis, we were just doing emergently in-house here. So it was just kind of trying to get creative with how we could do things and just open more things up to the community. So honestly, our dialysis patients that came in all got dialyzed. Cancer treatments we did as well as we could in-house, and then kind of worked around, or if there were other surrounding areas where they could go for temporizing measures, we tried to institute those.
And for nurses and doctors that we've spoken to at other hospitals, I mean, they're dealing with a lot of stress, long hours, watching people come in, get very sick, get put on ventilators, losing patients. I mean, it's tough on you all.
Yeah, it gets challenging. COVID really kind of did it to us, and this was definitely, as you said, it was a 1-2 punch. You kind of go back to your core values a lot when you start doing this, or when this kind of thing happens. And so, I always walk around here saying, look, I'm standing upright, healthy, my family's healthy, what else do you need? And just put the rest forward towards your patients. I mean, we've had an amazing team here. They have gone, we had an A team who worked during the storm. Then there was a B team that came in and did recovery. They are staying in the hospital 24/7. They have been remarkable. I think they draw a lot of strength from each other, and that's really helpful. And then again, you break it down to the core reasons why we all did this, and you just get right back to the patients. And it actually, believe it or not, for us, that's therapeutic. I mean, you have to stop healthcare providers a lot and tell them to really look into their own wellness and their own mental health and recovery. And I think that we've done a good thing, both from an administrative standpoint. We've offered those services. Our psychiatric services actually offered up being able to call them if you needed to have conversations with them. So definitely trying to put that on the forefront, but we've just been kind of trying to feed off of positive energy with one another.
Yeah, and you get a good night's sleep, and you all have homes that have been damaged too and things like that. How many hurricane-related injuries have you seen come into the hospital there at Turo?
Here at Tulane, I gotta be honest, so we've seen a few.
I'm sorry.
That's okay. We've seen a few. You tend to see the, using a chainsaw to clear my trees, and also I'm on a roof doing a tarp, and I slipped, and it's an orthopedic injury. So we've seen some of those orthopedic injuries. Actually, shockingly, we haven't seen as many as I thought we would, but I think that as people come back more and more, we're going to wind up seeing that. We're actually seeing a lot of heat exhaustion. I've been without power. People who are actually having, they're coming in with kidney injuries. They're so dehydrated. So that's the vast majority of what we're seeing. And then, unfortunately, just like you kind of mentioned, sequela to what you've had before. Hey, I have coronary artery disease. I'm coming in, and there, people having heart attacks. That stuff doesn't stop. So we've had it, and luckily, with being back on city power too, a lot of those services for us have come up, like our cath lab, et cetera.
And right now, how many COVID patients do you guys have over at Tulane?
You know, I don't have the exact numbers, but we're at about 20-25% of all of our patients. So that's kind of the general area where
And
we
then
are.
what about your ICU?
Well, most of our facilities are actually full. So, like I said, we're boarding. I can't give you the exact number, but I want to say somewhere between 7 and 10 patients in our ER who are admitted between ICU, med surge, et cetera. So all the upstairs beds are full, and then we are nearing capacity downstairs. But then yesterday we were able to, do some case management stuff and get a lot of discharges happening from the hospital.
Yeah.
So we're hopeful to kind of be able to kind of keep it in rhythm. And for patients that need workups, but that don't necessarily need emergent admission, we're able to keep those things going because we're kind of, even if we have to do it out of chairs, we've had a lot of help. So we've had a lot of nurses coming from out of town and some backup help. So now more than ever, we're actually pretty well staffed, and so we're able to get a lot of that workup done out of the ER.
And I know some other hospitals have had to turn patients away. Have you guys had to do that at all over at Tulane?
No, not once.
Okay, good.
We have taken everybody, and there are reasons. A lot of hospitals had issues like their CAT scanner went down, or again, water pressure, which is a safety issue. You can't run your sprinklers. You can't, patients can't go to the bathroom appropriately. So they're all good, legitimate reasons, and the community's gotten together. So we'll get phone calls from other hospitals. I'll have physicians calling me out of other ERs and telling me just exactly what's going on at their facility. And so I think that, as much as you can help out, you help out. And so that's kind of what we've been doing.
And last question, I'm out of time, but are you on generator power or city power right now?
We are back up on city power. September 1, we got city power and then started transitioning over so it would be smooth to generator, and we're on full generator now. I'm sorry, full city power now.
Okay, great. All right. Thank you very much. We appreciate the time.
You're welcome. Thanks so much for hearing us out.